I'm Dr. Ajay Dogra. I'm a consultant psychiatrist, Kailash Hospital in Noida. The That's actually adolescence. Like a school-going child is in his late adolescence, like in class 11, class 12, or early young adulthood. I will say the kids going to college, they are passing through. They are slowly transforming or making a transition into early adulthood. So these are a special section of the population which is different from the adults and the kids, like the child, which are like children who are like under the protection of the parents. And adults are have actually attained their complete adulthood, so they are no more like under supervision, or they are providing the supervision. So this special section was like late school age and the early college age are like very vulnerable section of the population, which are like, I commonly use this term like called adolescent crisis. They are passing through a phase of crisis in which they have a lot of confusion which is related to their bodily changes which is happening in this phase, like they are growing up, bodies under the effect of hormones, male sex hormones, female sex hormones, and those hormones are giving them extra energy. That energy is surging up. So there's a lot of energy in the sense that they want to do a lot of things, but they have this tendency to become aimless because they want to achieve so much. So that is mainly determined partially by their biology, and secondly by the environmental factors, like there is a generation gap between their parents and the children. When they are growing up, they are demanding, they have a tendency to defy you know the 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 adult supervision. So they have the tendency to not take orders. They want to have take the control, while the parents are trying in the opposite direction. They are trying to achieve, their exercise their control, which the children in this phase, in this age group, are trying to deny. So there is a lot of struggle of power that happens between the parents and the children, and that leads to increases this conflict in them, and that can at times lead to a lot of frustration, irritation, depressed mood. So that is what is commonly known as commonly known by the term called adolescent crisis, which is given in the psychiatric textbook. So, as I was saying, there is a gap between the one generation and the other. So that generation gap, it actually leads to frustration, a lot of aggression at times, irritation, depressed mood, sleep difficulties, changing in eating habits, talking negative, pseudo-philosophical thoughts. So these are the symptoms that come whenever a child in this age group is confused, is looking for help. They actually are looking for help. So there is a lack of communication. So whenever there is a lack of communication between the parents or the teachers and the students or the children at home, so that gives rise to a situation where there is likelihood of development of these depressive symptoms in the children, and they can at times take to extreme steps whenever they are put to stress, like if they fail in their exam, if they fail to qualify for in the interview, or if they are scolded badly. So that is the time when they feel very much frustrated, when they become very impulsive. So suicide is an act of impulse. So whenever there is a state of crisis like this, whenever the child is unable to clear the exam or interview, that is the time when he needs the most, the maximum support from his the caregivers, like the teachers, like from the parents. So if that is not available, these symptoms of depression, irritability, aggression, impulsivity is likely to happen. That is when the suicide is most likely. So whenever there is depression, whenever there is irritability or aggression or mood swings, so one should take proper treatment in the form of medications. There are medications called antidepressants or medications for anxiety, which help the children a lot to see these phases off. And other than medication, they need a lot of support from the family, from the teachers, whosoever adult who is available to them, a, forming a proper communication, teaching them how to communicate their anger, rather than putting them into such silly actions. They should learn to communicate their anger out, their frustration out. So that is what they need to be taught. So the communication is essential. A supportive treatment is very much essential. And in case of severe illnesses like borderline personality disorders, where the suicide is the commonest, we need a detailed psychotherapy, but that is not very common. So that is comparatively rarer, but that we treat with a detailed psychotherapy, which we call dialectic behavior psychotherapy. So that behavior therapy, detailed psychotherapies are essential, but they are not very common. Commonly what we require is just simple support, a word of encouragement, understanding, listening. I mean, if the parents or if the teachers listen to the youngest problem, even that is very helpful. And whenever somebody is very impulsive, very emotional, that is the time when a person is likely to take such a drastic step. And I've seen it, that if we just give a few minutes of listening to such a person, like just listening to his problem, and the suicide can be averted. Most of the time suicide happens only if there was nobody to hear to his problem. If you hear that person's problem just for a few minutes, that person comes back to his senses, and then he realizes what a silly thing he was gonna do.